Madam Speaker, what is before the House today is this is not a serious legislative effort. It's a series of sound bites that mean nothing. Committees don't have to do anything. Speaker Boehner is quoted in the Hill basically saying that he's not going to hold any of these committees accountable. They can do it if they want to, whatever. If they don't, so be it. And what we're dealing with here today really is kind of a political ploy, not a serious legislative effort to replace anything. You know, my friends on the other side of the aisle have got up over and over and over again and said, well, you know, we're really with you on pre-existing conditions. We're really with you on the donut hole. We're with you on allowing parents to keep their kids on their insurance until they're 26. But yet, they're really not. Because if they were, they wouldn't have voted yesterday to repeal all those protections. And if they were really with us, then we would be talking about today coming to the House floor with a series of initiatives that would actually continue to protect those benefits for consumers. But they voted to repeal all of that. And I want to know, how can anybody in this House, how can anybody, in light of the protections that have been put in place, go back to an individual who has been who's now able to get health insurance because we prohibited insurance companies from discriminating against them for pre-existing conditions? How can you go to them and say, well, we're going to change our mind. We're not going to do that anymore? How do you go to senior citizens who are struggling with that donut hole, and we've begun to close it? How do you go to them and say, we're going to raise your taxes? And how do you do that? How do you go to a parent whose child can remain on the health insurance because we've extended it to allow them to stay there until they're 26 and say, well, that doesn't matter anymore? It just doesn't make sense. That's not what people voted for in the last election. They didn't vote for you to repeal. All was this distortion of a health care bill that you put out there, my friends on the other side of the aisle, that was very well funded by the most expensive advertising campaign funded by the insurance company in the history of our country. This distortion out there, yeah, I mean, everybody was against that distortion. That is not the reality. And as the months have gone by and as the reality has become clear to people, as they have seen the benefits and the protections, as people have been able to wrest control of their health care from the insurance industry, as the consumers realize they have more and more rights, as there are more and more protections that are built into law to protect people of all ages, people say, well, we don't want you to change that. We want that to be saved. And I'll just say one thing. When my friends say, well, we could just do a little bit of this and a little bit of that, you really can't, because it's kind of like a domino effect. Everything has an impact. So this is a serious debate, and if there's some indignation on this side of the aisle, it is because we know that this is a big deal, and real people, you know, who have real challenges affording their health care and dealing with the complexities of the health care system and the inequities of the health care system are now getting some relief, and they will be hurt by what you are doing. So let's be honest here. What happened yesterday was my friends on the other side of the aisle went on record as saying we're against everything. Today, we're going to pass a resolution, I guess, that doesn't do anything, doesn't even require committees to do anything, but just says we're for all these nice feel-good sound bites. That's not a serious legislative effort. That's why people are cynical. We can do better. I urge my colleagues to vote no on this.